The concept of testosterone conjures us thoughts of masculinity, strength, and virility. It is commonly referred to as the male hormone, and it plays an important role in the development of traditionally male sexual features. But testosterone's effect goes well beyond physical characteristics. This potent hormone has a substantial influence on men's emotions, cognitive performance, and general health. Testosterone is a steroid hormone generated mostly in the testes, but also in minor amounts in the adrenal glands. It is the principal androgen that develops and maintains male reproductive structures and functions. This comprises the testes and prostate, as well as secondary sexual features like as muscular bulk, body hair, and a deep voice. Testosterone's effect extends beyond the physical realm to include mental wellness. It affects several brain areas, having a substantial influence on mood regulation, cognition, and behavior. Understanding these multiple responsibilities is critical for comprehending the intricate relationship between testosterone and men's overall health. Testosterone levels are not static. They normally fluctuate during a man's lifetime. During puberty, testosterone production increases, causing the dramatic physical changes that turn boys into men. Levels peak in early adulthood, usually in the late teens and early 20s, coinciding with peak physical strength and virility. However, after this peak, testosterone levels steadily decrease by roughly 1% every year. This decrease is a normal component of aging and can contribute to a variety of age-related changes in males, such as mood swings, energy levels, and cognitive performance. The relationship between testosterone and mood is complicated and not completely understood. However, evidence indicates a robust link between testosterone levels and emotional well-being in males. According to studies, men with low testosterone levels are more prone to experience sadness, anxiety, irritability, and decreased motivation. In contrast, several studies have suggested that boosting testosterone levels within a healthy range might enhance mood, boost emotions of well-being, and alleviate depression symptoms. Thank you. However, it is important to emphasize that correlation does not imply causality. Other elements influencing mood regulation include heredity, lifestyle, and environmental stresses. Testosterone's effect on cognitive performance is also complicated, having both possible benefits and disadvantages. This hormone affects several brain areas involved in cognition, including the hippocampus, which is important for memory formation, and the prefrontal cortex, which is responsible for executive processes such as planning, decision-making, and working memory. Studies have found that testosterone can improve certain cognitive skills, specifically spatial awareness and visual spatial memory. However, other studies show that elevated testosterone levels may negatively impair other cognitive areas such as verbal fluency and emotional empathy. The link between testosterone and memory is the subject of continuing study. Some studies show that testosterone may improve certain forms of memory, such as spatial memory, which includes recalling places and navigating settings. For example, one research discovered that males with greater testosterone levels performed better on activities that required them to mentally rotate objects and traverse mazes. Other research has found that high testosterone levels may have a detrimental impact on verbal memory, which is the ability to recall words, lists, and tales. More study is required to properly comprehend these complicated connections. Testosterone also appears to influence attention and focus. Studies have found that males with greater testosterone levels perform better on activities that require prolonged attention and focus. This might be because testosterone affects dopamine levels in the brain, a neurotransmitter that controls motivation, reward, and attention. However, increased testosterone levels have been associated to impulsivity and risky conduct, which can impair focus and decision-making. The ideal testosterone level for cognitive performance is expected to vary by individual and cognitive domain. While testosterone is essential for men's health, unusually high or low amounts can have negative consequences. As previously stated, low testosterone can cause mood fluctuations, exhaustion, and reduced libido. It can also cause physical changes such as decreased muscle mass, increased body fat, and bone loss. Excessively high testosterone levels, as seen in anabolic steroid misuse, can cause hostility, impatience, and poor judgment. It can also result in bodily issues such as acne, hair loss, and prostate enlargement. In this part, we look at the complexities and reality of testosterone replacement treatment, sometimes known as TRT. Testosterone replacement therapy, or TRT, has grown in favor in recent years as a strategy to offset the consequences of age-related testosterone loss. Many men seek TRT to treat symptoms including exhaustion, low libido, and weight gain. They also lose muscle mass in the hopes of regaining vigor and improving their quality of life. TRT entails augmenting testosterone levels with a variety of ways, including injections, patches, and gels. Each approach has its own set of benefits and considerations, and the decision is often influenced by the patient's lifestyle and medical history. While TRT can help alleviate symptoms of low testosterone, it is not without hazards. Patients must be informed of the possible adverse effects and measure them against the advantages. TRT can induce acne, sleep apnea, and breast growth in males. These side effects range in severity and may need extra therapies or lifestyle changes to control. It may also exacerbate pre-existing diseases such as prostate cancer and heart problems. Men with a history of these illnesses should be especially careful and have a complete medical examination before beginning TRT. As a result, TRT should only be considered after a thorough review by a healthcare practitioner and administered under rigorous medical supervision. Regular monitoring and follow-up meetings are critical for ensuring the therapy's efficacy and mitigating any hazards. Always visit a healthcare physician to see whether TRT is good for you. Men's health is a complex issue that necessitates a thorough grasp of the different factors that contribute to total well-being. Testosterone has an important role in men's health, yet it is only one piece of the picture. It has an impact on muscle mass, bone density, and even mood, but focusing simply on testosterone may ignore other essential factors. A holistic approach to men's health takes into account a variety of issues, including genetics, lifestyle, and health, diet, exercise, stress, and hormonal balance. Each of these aspects is important for sustaining good health and should not be overlooked. Maintaining a healthy lifestyle that includes regular exercise, a balanced diet, stress management strategies, and proper sleep can naturally boost testosterone levels and enhance overall well-being. Activities such as yoga and meditation can also assist to reduce stress, which is a key factor influencing hormone balance. Men should also be proactive about their health by arranging frequent visits with their doctors, sharing any concerns about testosterone levels or overall health, and getting professional help when necessary. Regular medical appointments can aid in the early diagnosis of possible health problems, allowing for quicker action and improved treatment of health disorders. Taking ownership of one's health entails not just addressing issues when they emerge, but also providing preventative care and making educated decisions to live a better, more satisfying life. Testosterone, commonly referred to as the male hormone, has a significant impact on men's physical, emotional, and cognitive health. It is essential for the growth of muscle mass, bone density, and fat distribution. Beyond these physical characteristics, testosterone has a substantial influence on mood, energy levels, and general mental health. While its function in male sexual development is well understood, its effects on mood, memory, and focus are complicated and diverse. Testosterone levels can affect cognitive skills including memory recall and attention, making it an important hormone for maintaining mental sharpness. Understanding the complex link between testosterone and men's health is critical for fostering overall well-being throughout life. The levels of this hormone naturally fluctuate with age, and knowing these variations can aid with better health management. Regular checkups and meetings with healthcare specialists can help you maintain healthy hormone levels. By understanding the normal changes in testosterone levels, the possible advantages and cons of this strong hormone, and the significance of a holistic approach to health, men may make educated decisions to preserve their physical and mental vigor as they age. Regular exercise, a balanced diet, and stress management skills can help maintain optimal testosterone levels, resulting in a more vibrant and happy life. Looking for high-quality supplements backed by Dr. Andrew Huberman himself? Check out the links in the description below and subscribe and hit the bell icon if you've learned anything new or anything of value.